All right, good evening, everyone. My name is Dr. James Smith. I am the Medical Director of Emeritus of MindPath Care Centers. I've been with the practice now roughly 16 years, and I can say without a hesitation, it's been a thrill and an honor to be part of MindPath. Today, we're talking about COVID-19 and its impact on the mental health of minority groups. Clearly, we know that many minorities work in fields where they are considered critical, whether that's housekeeping in a hospital, nursing services, bus drivers, subway workers, but critical jobs for maintaining the infrastructure of the average community. Unfortunately, because of that, we are also exposed to COVID-19 at a greater rate. And so this evening, what we're going to be talking about is the impact that it has on us from an emotional standpoint. And we're going to talk a little bit about how we can overcome some of these social determinants of health and build resilience in each of us so that we can get through this pandemic and continue to live our lives on life's terms. Mr. Mackey.
All right, so my name is Kerry Mackey. I'm proud to introduce myself as one of the advanced practice providers with MindPath Cares, a leader in psychiatric and mental health community in North Carolina. I practice out of the Bush Street office in Raleigh, North Carolina, and I see children and adults diagnose and treat, maintain, and stabilize a variety of mental health conditions, including to but not limited to depression, anxiety, some adjustment disorders, ADHD, and mood disorders. I'm a native of the Bahamas originally and now a permanent citizen of the USA, but more importantly and proudly, I'm a member of the Black community. And so it's my pleasure to serve on this panel today where my colleagues and I, as Dr. Smith alluded to earlier, will highlight some of the challenges that we as minorities face in our community with regards to both physical and mental health. One of the things that I've expounded upon is in my practice is that individuals in the patient population is very diverse. I want to address a glaring recurrent theme that I usually encounter, however, upon interacting with members from a diverse and from the minority community. Frequently, I hear individuals bring up remarks such as, I should have came here a long time ago. I hear people say, wow, I can't believe what a difference this has made. Others, I hear people say, others in my family deal with similar situations to this, but they would never come here. Or I could never talk to my mom, dad, my siblings about this. They would think I'm crazy. One of the hardest things I've had to hear is, I don't know what's wrong with me. Why am I having these thoughts? My people aren't supposed to think like this. And so further on in the conversation, after Daja kind of introduces herself, I'll kind of expound upon this stuff a little bit more. And so I'm going to turn the floor over to Daja so she can kind of introduce herself.
Ms. Mayner, go right ahead. Hit your mic again.
Thank you. Is that better? Thank you, Dr. Smith and Kerry, for that sort of wonderful setting of the stage. As they mentioned, my name is Daja Mayner. I am a psychotherapist based out of the Charlotte office. I've actually been with MindPath for about 4 months now. However, my background of about 3 years in field-based services, providing sort of in-home family therapy in rural North Carolina communities. With MindPath right now, I'm focusing primarily serving adults with some adolescents, treating anxiety, depression, that trauma experience. In today's talk, specifically, as my colleagues have alluded to, we'll talk about sort of what those risk factors around sort of this collective experience of trauma as it relates to COVID, and talk about how, COVID's experience is really amplifying or magnifying maybe people in the sort of communities of color. They're already sort of pervasive relationship with trauma. And we'll actually, sort of later on in the conversation as they discussed, talk about what building resiliency can look like and sort of being able to create a different reality, a different experience with psychiatric care. So that's
very good.
That's all. Thanks.
Well, that's huge because when you said my favorite word, resilience, and this is what all of us need to get through. To move on, if I could start, Kerry, would you be kind enough to tell our audience when a patient comes to you, how do they feel about, say, going on meds?
Right. So that's a big thing, Dr. Smith. Because of all of the stigmas that surround mental health in the African American community, a lot of patients are hesitant for treatment with medication management per se. I've tend to notice that, that some of them are probably a little bit more open to therapy. And so, because I see that there's a combined synergistic effect with medication and therapy that, leads patients to having this robust response and an improvement in their mental health condition, sometimes I kind of like, avoid the discussion of medication on the first session, and I would get that patient kind of referred to a therapist so that they can develop to begin a therapeutic alliance. And then once that gets established and we kind of warm them up, so to speak, then we re-enter the conversation of medication. And then I hit them with statistical facts. I kind of talk to them about, the fact that a combined treatment with medication and therapy, psychotherapy specifically, cures about 80% of depressed patients. And then they're a little more open to it. We still have a lot of people that take a step back from it. But I think, with statistical data, we see that more people are open to the aspects of, I will use medication if it will help me get better.
Very good, very good. Ms. Mayner, would you be kind enough to talk a little bit about, you mentioned earlier the collective trauma and impact on our community vis-a-vis COVID-19. Daja, take it from there.
Absolutely, Dr. Smith, thank you. So when I refer to sort of trauma, sort of put simply, right, is a deeply distressing or deeply disturbing experience, or sort of like an experience that questions our sense of safety, our sense of security. And so if we take that definition, that simple, albeit broad definition of trauma, and we apply that to something such as a global pandemic, it's very clear to see that, with so many drastic implications of this disease, it's sort of having that shock factor and that deeply disturbing, sort of overwhelming our sense of our ability to cope. When you, to sort of answer that second part of your question in terms of why is this sort of magnified or amplified for communities of color, the reality is, for so many minorities, we are, touching on that social determinant piece of health, we are statistically sort of more exposed to trauma and less likely to receive any treatment, to sort of receive adequate and culturally competent treatment. So it's like you have this, your everyday experience is already sort of one that makes you question your sense of safety, and you're adding this additional unnerving experience of the global pandemic, sort of folding in that our mention of how many African Americans are already sort of in roles where they are considered essential and they are sort of at increased risk. It is, as you all can imagine, a very unsettling experience and sort of a very traumatizing one. We've talked a little bit about the social determinants piece around, but Dr. Smith, would you please sort of expound upon that concept?
Oh,
sort of what are some social determinants?
One of the struggles that we have we as minority groups live more in urban versus rural environments. And when you're in living in a situation where there's a dense population, there is greater transmission of any disease, whether that's COVID-19 or SARS or any of the other ones that have afflicted pandemics in the past. And unfortunately, with that being the case, we also have a social situation where many of us have older family members living with us. So that when I go out and I work my shift at the hospital, I come in contact with a positive COVID person. I've been working in housekeeping, and then I go to my second job at the nursing home, or again working in housekeeping, and unfortunately, I may be COVID-19 positive. So I then spread the illness to my second job. I then bring that illness to my home. Well, and then we know that for some young adults, while they may develop the illness, they may not have a severe reaction to the illness, but grandma has a significant reaction to the illness. And so you're 100% correct. We have an increase in morbidity and mortality because of this. And we're just stuck because we don't have the ability to address social distancing as some can. However, as we talk about this, one of the other things is when we come into the office, folks struggle because you've got both the medical thing going and the mental health thing going. Mr. Mackey, Kerry, would you be kind enough to talk about how people struggle with both the physical ailments and mental?
Yes, definitely. So I kind of talked to this about this before in a previous discussion that I had, and I like to always go back to to a point that is made that as human beings we are holistic creatures, right? And so there are multiple aspects of us as an individual, right? So we have our physical health, then we have our mental health, and then in more than one ways we have a spiritual being or a spiritual health also, and all of these things kind of play on top of each other. And so our physical health kind of ties in almost directly to our mental health, right? So if we have physical ailments such as diabetes, hypertension, things that run rampant in the minority communities, whether it's because of the access to the foods that we tend to eat, or if it's because of the cultural dishes that we make, we already have disadvantages in terms of having higher values or having higher numbers statistically with dealing with diabetes and hypertension. And then we kind of take a look at, those things are systemic. And so if our health is in poor condition, then our mental health begins to struggle, because now we're worried about health care. African Americans are 20% more likely, and this is according to the HHS Office of Minority Health, 20% more likely to report serious psychological distress than our peers, adult whites. One of the things that we kind of look at is, poverty, right? So Black African Americans living below the poverty line are 3 times more likely to report serious psychological distress than those living above the poverty line. And so with that comes more sadness, also comes more feelings of hopelessness, worthlessness. These are all traits and features that kind of align with depression, as well as some of the things we see with post-traumatic stress disorder, and other mood disorders. However, we really don't classify it because we kind of stray away from getting diagnosed because we don't really seek mental health treatment. And so we have these symptoms of something and we really can't put our fingers on what it is exactly, but because we're suffering physically, then we also have this implication of where we start to suffer mentally as well. And so the two are kind of combined in one. You know, a lacking physical health also pulls down, you know, the mental status and the mental health of an individual also, Dr. Smith.
Very good. Well, Ms. Mayner, Mayner, would you be kind enough to talk about, if I'm the essential worker, what would you recommend to me?
I absolutely can. And I actually would sort of recommend a couple different things.
Please.
Speaking directly to Mr. Mackey or, you know, Kerry's points about, you know, there are sort of different aspects of health, right? There's that physical health. That means, you know, sort of doing things to get your body moving, you know, doing things to get your body moving in sort of in a different environment. And that can literally just be like standing outside. You know, it doesn't necessarily have to be, I don't have the different, you know, things at the gym. Like, yes, it's great at the gym, but, you know, making the decision to tend to that physical health be dependent on the location is really, you know, can really cause problems. So it would be, you know, looking at how can I incorporate some physical wellness pieces, you know, that mental health piece. You know, as Kerry was discussing, he's really talking about sort of that twofold effect of stigma, right? Like, you know, I don't really want to share this with you because I don't want you to pathologize me or diagnose me, but it also reinforces that sense of loneliness and isolation that people feel when dealing with this, right? So finding someone, you know, that can be that trusted support, right? We all sort of need that social support. Seeking out professional help is great, but, you know, you're an essential worker, maybe your insurance isn't great, you know, or you're not really having, you know, adequate health insurance. I would advise you to find someone that sort of that can be that refuge, like you all can support each other in that way. That other piece around sort of things that we can do to protect our mental health that's not at all like determined by another person. A word that comes to mind is sort of the boundaries, right? Sort of the limits that we place around what we ingest or sort of like what we engage in, whether that be information, you know, so like making sure that you're getting your information about this from reputable sources and making sure, you know, if you're the type, if the way that your anxiety works is, you know, I'm hearing something, I hear this one thing and my mind sort of goes all these other places, then maybe that means, you know, not engaging in the news every day, but maybe once a week or something. You know, just sort of like changing, being mindful of how your mood is affected and taking that serious, right? Sort of like prioritizing that, because it is all very much connected, as, you know, Kerry pointed out. Dr. Smith, you know, I think that this kind of talk is leading us sort of into this idea of resiliency.
Exactly.
That we sort of pointed out before.
Yeah. So what are your thoughts on that?
Well, resiliency, you know, one definition is sort of the understanding, the ability to sort of adapt in significantly stressful or traumatic situations. And this conversation is really about strategies, you know, like ways that people can build up that resiliency, exercise sort of that muscle. I think it's, you know, it's a necessary part, like what we have come to understand, right? It's a necessary part for adapting to trauma. Kerry, can you speak a little bit more about maybe some of the barriers, like I mentioned, you know, the healthcare piece. We sort of talking about the healthcare piece. Can you mention some barriers to that part?
Right, absolutely. I can definitely like to, you know, kind of go back to some of the earlier components of the conversation that you had, specifically the stigma that you talked about, right? So I talked about that a little bit earlier, but when we kind of talk about mental health problems, you know, one of the major issues with mental health that, you know, that we face or that we think about first is depression, right? That's like one of the top diagnoses in terms of mental health. And so we look at depression a lot of times, oftentimes in our community, you know, you hear people say, oh, it's a weakness per se, or it's a condition, you know, but it's a condition that can affect individuals as a whole. So your thoughts, your bodies, as I kind of mentioned before, and seeking professional help is very necessary. So, you know, lightly, I've, you know, heard even my family members, people that, you know and care about, say, oh, you just need to go to church maybe, you know, or they'll say, you know, you kind of need to go talk to a pastor or just talk to somebody about it. And it's good to have that spiritual guidance and stuff. But just like physical ailments. So like if you had really, really high blood pressure, you'd go and get medications per se for blood pressure to reduce like your systolic value. Similarly, if you had a high blood glucose value or a high hemoglobin A1C, you'd get medications and get on a proper diet regimen to kind of reduce that. And so when we think of mental health, you know, not just depression, but other mental health things, these really have a role and impact on like the chemical pathways of the brain. And so because there's disruption in like neurohormones and the chemical pathways of the brain, these things too require some form or format of medication at times to help to stabilize an individual. So I just kind of wanted to bring up that point real quick before I made a point to talk about you know, some of the issues with access of care. But in terms of access of care, I'm a very, very a vocal person about this topic. And so, you know, I'd like to highlight, you know, when the Affordable Care Act kind of came about, it closed the gap in uninsured individuals, right? So it was about 16% of African Americans that no longer had health insurance versus about 11% of white Americans that were still uninsured back in 2014. In 2012, when we kind of looked at it, the percentage of people who are unable to get or delayed in getting medical care, whether this was physical ailments or mental health ailments, prescription medication for it, it was a clear discrepancy. So it was about 18.7 people that didn't have health insurance couldn't get care, as opposed to maybe about 8% of people that did have health insurance, you know, that maybe just couldn't afford medication or afford the copays. So glaring discrepancy. Down in 2011, about 54.3% of adult Black African Americans with a major depressive episode received treatment for it. So only about half people that actually came in for depression kind of continued with and received treatment, you know, whether that was even in remission or not, as opposed to about 75% of adult white Americans that came and received treatment, you know, for their depressive episode. You know, and these statistics can like continue to go on and on. You know, I mean, we can call numbers off pretty much all day where some of the gleaming discrepancies exist. One of the things, you know, is that, you know, we like to, at times, you know, go where we're comfortable, right? And so when you look at the American Psychological Association, and the numbers might have changed a little bit now, but there was less than 2% of the APA's members that were Black or African American. And so you could imagine how much access to care there was for somebody that kind of looked like you, you know, and kind of had some of the same cultural values and beliefs, you know, that we had. And we kind of compounded that fact by, you know, some Black and African American patients reporting, you know, experienced either, you know, increased racism tunes or microaggression, you know, whether it was treatment from a medication provider or from a therapist that didn't associate with some of the stigmas that, you know, that we associated with. And I'm going to leave this last point about this in terms of access of care, and I want to hear more from Dr. Smith on this, but when you talk about Black or African Americans today, they are overrepresented in the jails and the prisons, right? People of color account for about 60% of the prison population in the US. Black and African Americans also account for about 37% of drug arrests, while only 14% of regular drug users are Black or African American. And so once again, a glaring discrepancy. Dr. Smith, can you talk to us a little bit about how, how the system, the prison system numbers of COVID that are on the rise, how does this play into the numbers of African Americans that are impacted by COVID-19?
Well, it's quite significant in that COVID-19 is coming into the prison system by staff members. These same staff members are working multiple jobs. They may be an off-duty police officer working a second job. They may be an EMT. They are working a critical job outside the prison system. They contract or come in contact with COVID-19. They are COVID positive. They come to work, and because of the close confines of any prison, any of these, because there's no way to socially distance oneself when you're in that lockup. And as we all know, these prison units are greatly overcrowded, and they are a perfect petri dish for passing of the disease. And unfortunately, we're now seeing deaths. I think here in North Carolina, we just had our very 6th or 7th death within our system. And unfortunately, I think this is going to be a situation that will only increase. The other struggle that we have as African Americans, and we learn this from what we call our community health assessment. Every 3 years here in Wake County, the hospitals, the public health department, and social services, and while I know all this, I was chairman of the board of social services and public health for the last 7 years. And so we do this thing called the community health needs assessment. And one of the most important things that was said by the people in the community, especially of the minority groups, both African American and Latinos, that the caregivers did not have the cultural sensitivity to understand what we were going through, and we did not feel as patients that they could feel where we're coming from. And it was a request by many of the individuals that did the surveys to train care providers in cultural diversity so that they could get a feel and understand us as patients. You know, one thing about the medical world, you have to be very bright to get into medical school. But that doesn't mean you're the most psychologically minded individual, all right? And so, and you may not have a contact with folks in a lower socioeconomic populations or cultural situations to know. So what's one of the things I'm so proud about MindPath is that MindPath has had repeated cultural diversity training, whether that's the gay and lesbian community, whether that's the African American community, soon the Latino community. So MindPath Cares is going to be on the forefront of being significantly sensitive to the needs of the minority groups. But one of the other important pieces, and Mr. Mayner, if you don't mind, can you talk a little bit about, you know, when I come home and I'm stressed, and my family members, well, what do I say? What do they say to me? They should talk to me a little bit. Hit your mic. There you go.
Fair, okay. Good. So you're coming home, you are stressed out, and that's maybe, you know, that might look like, you know, being short, you know, like sort of short-tempered or maybe quick to sort of escalate like a situation. because you're already at the brim. You know, your anxiety is already super high, or today was a particularly bad day. So I think it all absolutely boils down to that, like, attentiveness. Like, first of all, sort of that grace of, like, this is not just a normal, regular experience, right? I don't have to feel this way. And it's that sort of understanding of, you know, no one lives in a vacuum. You know, our lovely examples around, you know, what housing can look like, you know, sort of for African American communities. So if no one's living in a vacuum, you know, if you have this emotional experience, and that emotional experience is like a domino, and it's a ripple effect. It sort of starts with that, like, that perspective of, like, this is important. This is not me just, you know, like, being crazy, or, like, you know, something that I need to being crazy. This is not me just needing to dismiss this. This is me. This is my body, my mind telling me that, you know, I can't just go on as business as usual. So the number one thing I sort of encourage many of my patients to do is sort of take that break. You know, like, it's sort of carve out that moment of refuge when you come home. I know that, you know, depending on, you know, our roles and responsibilities in our family systems, that some people are responsible, you know, sort of for that caregiving piece, you know, of either young children or older grandparents or whatever. Older adults in their lives. But for many, you know, there is sort of that opportunity for just 5 minutes, 7 minutes, 10 minutes of, I just need to decompress. And you can give yourself that grace, you know, to say, like, this is important and this is necessary for me. And you know, it also sort of ties directly to what Kerry was talking about in terms of accessing care, and you know, like, finding competent providers, you know, competent in terms of your profession, but also culturally competent, culturally sensitive providers, and sort of being willing to engage in these conversations around what's actually going on for you, and hearing that sort of supporting information around how this is actually not just made up, or something that you can, you know, sort of think away, or something like that. Kerry, I mean, you know, we're having this rich discussion. Do you have anything that you'd like to add to that? Sort of, whether it be, you know, those other social factors.
Yeah, and if you don't mind, Kerry, why don't you say your few words? We're going to start to wrap up. So Kerry first, Daja second, and then I'll follow.
Fair.
Right. And so, you know, as I alluded to, and I'll try to keep this short, but I'm very, very passionate about this, you know, not just because, you know, because it involves, you know, people that look like myself, but because I'm passionate about mental health and access to care for all individuals, you know. But I definitely think about, you know, the African American and a minority population, the implications that COVID-19 have had on us. This isn't something that has only occurred, you know, and will pass over. There will be lasting impacts, you know, long-term effects of this, the social structure of the homes, you know, of jobs, you know, of many things revolving around this will change, you know, in the days to come. And, you know, and what really resonates with me is handle me with care, you know. We've already been through a lot, you know. By this age, you know, my age specifically, I'm, you know, almost 30. Most African Americans have either been imprisonated one time or more. They've had to deal with serious violent crimes that, you know, that some of our peers may not have had to deal with. There are a lot of traumas, you know, whether it's social or physical, you know, so many aspects of us have been impacted. And so, you know, I kind of urge, you know, us to treat each other with love, compassion, you know, and kind of focus on, you know, on helping each other to build in these tough economic, and tough emotional times. So, just to be there for one another and to let people know about the resources in the community that are available for them, because there is things out there. There are places that people can go, even when they don't have the access of care that, that we kind of mentioned a little earlier. So extending the olive branch and extending a little kindness will take people a long way.
Very good. Ms. Mayner, would you be kind enough to give us your words?
Absolutely. Honestly, it's going to piggyback much off of what Kerry said in terms of finding, orienting ourselves to a sense of community, because, a collective trauma such as something like this, is absolutely going to have those implications. And so while you may feel like you are pretty well adjusted, for many, African Americans specifically, it might not even feel like life has changed so much, right? Because you're still going to work and you're still using, the modes of transportation and all those other things, like normal. But there's there's sort of a disillusion there of like, since I'm functioning, since I'm doing as it, sort of the status quo, then I'm okay. And the reality is everyone is going to need support, no matter, how this thing shakes out for you, no matter what things you can point out in your life are different. Trauma is sort of that all extensive and all sort of expansive, like a comprehensive experience. And so, getting in with community and, giving yourselves that grace to just feel as you feel would be sort of my parting words. Thank you.
Very good. Very good. Well, thank you very much for giving your time for both Daja and Kerry. At the end of this, you're going to see some slides. There'll be some resources for those of the uninsured, resources for food pantries, because with the high employment rates and the like, folks are in need. However, MindPath Cares is at the forefront of harnessing the strengths of individuals, both Black and white. We're doing our best. We're sharing our faith, our family, our cultural institutions, because these are the backbone of support as we deal with this pandemic. Clearly, MindPath works with individuals, you've heard from Daja, to build that resilience, to empower folks and encourage individuals to stay alive, to get out and smell the roses. And I just want to thank everybody that's listening to this today. I hope we have provided you a little bit of insight on how we can come together and overcome these difficult times. And COVID-19 will pass. However, the new norm, we have no idea what it will look like, but we are resilient folks. We've made it for many, many years, and we'll continue to survive. I want to thank you for listening, and we wish you the very best.
Thank you.
Thank you.